Today, we're going to break down the modern game plan for treating rheumatoid arthritis. And we're not just looking at a list of drugs here. Think of it more like a strategic battle plan, one that's designed to fight and win a very complex war inside the body.
I mean, that's the real question, isn't it? That's the core challenge of rheumatoid arthritis, or RA. It's an autoimmune disease, which basically means your immune system, the very thing that's supposed to protect you, gets confused and starts attacking your own joints. So to fight back, you can't just go in blindly. You need a clear, multi-stage strategy.
And with any good battle plan, you have to start with clear objectives. Before you send in a single troop, before you deploy any treatments, you have to know exactly what you're trying to accomplish. What does victory even look like?
Now, this is where it gets really interesting. You might think the main goal is just to get rid of the pain, right? But look, minimizing pain is only one piece of a much, much bigger puzzle. The real mission is to get way ahead of the disease. You want to hit that inflammation hard and early, stop the joints from getting permanently damaged, and, make sure the person can actually live their life. The ultimate goal? To push the disease into remission, to make it go quiet.
So, how do we actually do all that? Well, the whole strategy is built on this idea, a stepwise approach. The easiest way to think about it is like a ladder. You start on the first rung, and if that doesn't get the job done, you climb to the next one, which is usually a bit more powerful. It's a really logical escalation.
So let's climb onto that first rung. This is our first response team. Their only job is to get in there fast, control the immediate chaos, and just provide some relief from the symptoms.
And this slide just perfectly lays out the two different kinds of forces we're dealing with here. On one side, you have your symptom relief troops. They're fast, they're great at knocking down pain and stiffness right away, but, and this is a huge but, they do not stop the disease from damaging the joints. On the other side, you've got the disease modification army. They're slower to act, but they are the long-term solution. They're the ones who actually stop the destruction.
Now, the drugs in this first wave are probably names you recognize. Things like ibuprofen, which is an NSAID, or steroids like prednisolone. And yeah, they are fantastic at putting out fires quickly. But their most important job, really, is to act as a bridge. They hold the line, they manage the symptoms, while we're waiting for our main army to get into position and start the real fight.
And here they are. This is that main army. These are the disease-modifying anti-rheumatic drugs, or DMARDs for short. And we've totally shifted gears now. This isn't about temporary relief anymore. This is about fundamentally changing the course of the war.
The general leading this army, the one that really forms the core of the whole strategy, is a drug called methotrexate. It's called the gold standard for a really good reason. It goes right to the root of the problem by dialing down that overactive immune system, basically telling it to stand down and stop attacking the body's own joints. For most people, this drug is the absolute cornerstone of their treatment.
Okay, but what if the main army isn't enough? What happens when you're up against a particularly stubborn or refractory form of the disease? Well, that's when you call in the special forces.
This is where the science gets really, really cool. Unlike methotrexate, which has a more broad effect, these therapies are like precision-guided weapons. They don't just quiet the whole immune system down, they take aim at very specific little signals, the communication channels the disease uses to coordinate its attack. It's a much smarter, much more targeted strike.
These special forces pretty much fall into two main groups, the biologicals and the newer JAK inhibitors. They're brought in when the standard DMARDs just aren't cutting it. But, and this is a big one, because they are so powerful and so specific in how they tweak the immune system, there's a critical safety check. You have to screen for hidden infections like tuberculosis before you start, because these drugs could potentially wake up an old dormant